So the second type of SVT we'll talk about is AVRT, AV reentry tachycardia. The difference between this and AVNRT is that instead of using the AV node to form this circuit, you use an accessory pathway, which people are born with anatomically. And the way that you realize that someone has an accessory pathway is basically with this delta wave that you can see on an EKG when they're not in the dysrhythmia. So what happens is the impulse comes down from the SA node to the AV node, and it's also hitting this accessory pathway simultaneously. Well, it travels through the accessory pathway faster than the AV node because the AV node holds on to an impulse to kind of regulate the rate. So it travels through the accessory pathway faster and goes cell to cell to cell to cell till it gets to the normal electrical pathway. Well, this slowdown here before it hits the normal electrical pathway forms this slurred upstroke of the R wave called a delta wave. And this is typically what you'll see in a patient with WPW when they're not in an SVT. Now, AVRT can be further subdivided into two different types.
Entirely online EKG course, covering fundamentals through advanced interpretation.